So again, welcome to today's webinar. We're going to be exploring Minnesota's paid family and medical leave law, and we're very lucky to have the folks who were responsible for and or who will implement that law with us today. My name is Michelle Adkins. I work with the Prenatal to 3 Capacity Building Hub, which is a project of the Build Initiative. And I'm happy to be here today with these lovely people and with you. We all know that paid family and medical leave is sort of in the news right now. And there are a lot of states who have either implemented versions of this initiative or who are working to and toward getting those policies and those laws passed. And so states like California and Delaware and Maine and Massachusetts and let's not forget the end of the alphabet, Washington, Wisconsin, and the District of Columbia, to just name a few, are either looking at paid family and medical leave acts and or have already implemented them or have passed those laws. So they've each used sort of different approaches. Some have engaged with the small business community to make sure that their voices are heard. Others have used sort of an academic and actuarial approach. So there's many approaches. We're going to focus on Minnesota's today. So our agenda includes, if you move to the next slide, please. Our agenda is, in just a minute, I'm going to introduce this fabulous panel that we have with us today. We're going to do an overview of the policy and sort of the timeline in which it's going to be rolled out. We're going to get to hear some really interesting things about how to get this kind of law passed through the legislature. And we're going to look at what advocates can do, and especially focusing on the equity dimensions of Minnesota's law. And then we're going to have a discussion and some questions and answers. So that's the plan for today. If you could move to the next slide. This is our fabulous panel of presenters today. We have with us Evan Rowe, who is the Deputy Commissioner of Workforce Services and Transformation at the Minnesota Department of Employment and Economic Development, which is also known as DEED. He oversees a number of programs there in his department, including unemployment insurance, state services for the blind, disability determination services, all sort of social programs there. And so, Evan, welcome. We're glad to have you with us today. We also have with us Greg Norfleet, who is the very newly hired director of the Paid Family and Medical Leave Program. He comes to this role after serving in senior leadership for multiple family-focused state agencies in Massachusetts. And we're glad that he's here today and that he's braving being on the webinar since he is so very new to this position. We're very fortunate today to have Dr. Alice Mann with us, who is the state senator in the state of Minnesota, who co-wrote the law and is going to talk to us about all the intricacies of how you get something like this, a policy like this, how you get it walked through the legislation and made into a law. She is a practicing emergency medicine physician, so she is very busy, and we're very glad that she has chosen to spend some time with us today. We also have with us Deb Fitzpatrick, who is from the Children's Defense Fund, Minnesota. She is the Director of Policy and Research there, and she collaborates with legislators, coalitions, agencies, and community organizations to advance research-based policies. And she has been a part of advocating for this law, and we're very glad to have her with us as well. So I'm going to stop talking and turn it over to the experts that are with us today. And so I'm going to now turn it over to, I think it's Evan and Greg, for them to talk a little bit about timeline and background.
Thanks so much, Michelle, and thanks everybody for joining. We're really excited to be here today. Just appreciate everybody's interest in the program, and we're going to talk through sort of just to set the table a little bit about what is Minnesota's paid family and medical leave program. A very brief introduction. We're trying to kind of kept it at a very high level. If folks on the call have more detailed questions about the legislation or what we're implementing, obviously we'll be happy to answer that as we get into question and answer, but wanted to give folks at least a high level overview of what we're going to be working to implement over the next couple of years here in Minnesota. Next slide, please. So if folks on the call are probably all aware, but just as at a very high level, what's this about? Well, paid family medical leave will ensure that Minnesota workers have access to paid leave during their certain key, critical life events. And it's worth noting that workers will have employment protections when taking leave under this law. Next slide, please. So at a super high level, if we're talking about kind of costs and benefits, right? Premiums, there's a premium rate that's set in as part of the law, set to 0.7% of the employee's wage, and about half of that is paid by the employer and up to half paid by the employee. We're going to start collecting premiums and paying benefits on January 1, 2026. Benefits can last up to 12 weeks for each type of leave, with a maximum of 20 weeks total across all types of leave in a 52-week period. And the exact amount is based on an applicant's previous earnings. It kind of scales based on how much you made before, with a maximum weekly benefit of the state average weekly wage, which is indexed to inflation. But this year, that would be about $1,287. Next slide, please. But let's why paid family and medical leave, and Deb and Senator Mann can speak to this in much greater detail than I can. But just at a high level, and something that we're trying to when we're telling the story about the program as we're working to set it up, why this program, why now? It's worth noting Minnesota is going to be the 13th state to implement paid family and medical leave in the United States. But only 7 countries worldwide don't have some sort of paid family and medical leave at their national level. Um, and what the research shows, what we've seen, is that states that have implemented paid leave programs have seen stronger employee retention. You see better health and development outcomes for children. You see higher labor market attachment for women and labor force participation generally. It helps people stay in the workforce after a medical event, after a pregnancy, after caregiving for a family member. And at the end of the day, it's also providing greater economic security for families. So, I think one might wonder, why is this program living in the state's Department of Employment and Economic Development? Well, this is a pro-worker, pro-employer law. It's going to help people stay in the labor force, and it's going to help. Which means it's going to help businesses make sure that they're able to retain great staff, and it's going to help workers so that they're able to thrive and find economic success. And now I'm going to turn it over to Greg to kind of talk through a couple key components about what's next as we're working to build out the program here in Minnesota.
Thanks, Evan. And I'm really excited to this is the first presentation that I'm making as the director of paid family medical leave for Minnesota. And I'm so excited it's with the Build Commit initiative. I'm coming from early education and care most recently. So like having early education, childcare advocates on the phone is comforting, and also really excited to have to continue the partnership with this group of folks. So as Evan mentioned, January 1st, 2026 is the big day that we go live with benefits for the paid family and medical leave program. But there's quite a bit of work that needs to happen before then. If you could click. We're actually going live with both payments and premiums on January 1st, 2026. So we're going to see payroll deductions hitting at that time, as well as benefits going out the door. Before we do that, there's a lot of work that we need to do together. We need to implement systems to be able to take in applications, to manage claims, pay benefits, collect premiums and wage information, conduct rulemaking, policy development, engage with and learn from Minnesotans, employers, medical providers, support services, and a wide range of stakeholders. And then we also need to hire a lot of folks to be able to do these things. But Minnesota has so many advantages in the way that we're going to be implementing this project. Other states needed to pre-fund their account, including Massachusetts. For those who don't know, I was the operations lead for the Massachusetts Paid Family and Medical Leave program before joining DEEP. And we needed to collect contributions 6 quarters ahead of time. That would have been, but here we're actually going to start with a amount of money in the benefits account so that we can pay benefits on day one before we have to take money out of paychecks. We're the 13th state to go. Other states have shown us part of the path to get there. We're going to literally borrow from what's worked in other states and skip what did not work. So how are we starting? First off, we do have a website set up, paidleave.mn.gov. You can expect that this website is going to be built out over the next few months, and we'll have additional resources on frequently asked questions and making sure that we're answering the most critical information for our stakeholders as early as we can. We are staffing up. We have some key hires out there. Please keep an eye out if you or anyone you know is looking to make a difference in the life of Minnesotans. We are actively looking for mission-driven folks to join the department and join our team. We're going to start engaging. This is a great start of being able to bring the advocate community that worked so hard to pass this bill along for the ride. One of the big advantages that we have is we have you all to help us along the way, and we're going to be in frequent communication, and the partnership that we're going to build is really going to make this a success. And we're big believers in iterative deployment. We're going to be continuously putting information out, putting working stuff out, getting opinions, making sure that we're building not just a system that's compliant with the law, but something that really works for the way that Minnesotans want to work with this program. Now, I believe we're shifting over to, who am I turning over to?
Hi, Michelle, are you gonna, okay, great.
Yeah, we're going to turn it over now to Deb and Senator Mann. We're going to talk about how all this happened and how they got it actually turned into law.
Great. Well, thanks everybody again for joining. It's an incredibly diverse group of folks from different states and different perspectives. So really excited to be here with you all. I am pleased to introduce and turn things over to Senator Elise Mann. As mentioned, she's an ER doc and an incredible author, chief author of our legislation in the Senate. I just want to say, as I'm giving advice to other states in terms of moving a policy like this forward, I would say the first thing is get yourself an author like Senator Elise Mann. So I'm going to turn it over to her for some opening remarks, and we may have some back and forth a little bit before I dig into the coalition work that led to this success. So Senator Mann.
Thank you, Deb. That was very kind of you. So getting this bill passed takes a couple things. One is electing the right people. First and foremost, elections matter, so that work begins during campaign season. Once you have that in place, then I think the most important things for us was the advocates. You have to have a very strong advocate base. These are the people who are going to show up at events around the state, at county fairs or what have you, setting up booths and talking to people about what paid family leave is and what it isn't. Because a lot of people have a very big misconception about what it is, right? I've heard people say to me, why would I stay home so that, I'm sorry, why would I pay extra so that you can stay home with your baby, right? That's what, when we say paid family and medical leave, that's what comes to mind. And so the education piece to the public is extremely important. And that's where the advocates come in to educate the public. They are also the ones who are knocking on doors in districts where perhaps a representative or a senator needs to hear from their people. And so having that strong advocacy base, number one, incredibly important. The other things I would say is that knowing your data is very important, because we have had the luxury of learning what works and what doesn't from other states, and we have to use that. And that's really important data and information to share, right? We know that this program results in decreased number of clinic visits for children. We know that this program results in a decreased number of hospitalization for children, that we see better maternal outcomes, both mentally and physically, that we see a decreased utilization in long-term care, a decreased utilization of childcare, both of which we are in a shortage crisis right now. And like Mr. Rowe mentioned, we see increased employee retention, decreased employee turnover. So this is not only pro-family, it is a pro-business policy. So knowing your data, learning lessons from other states, constantly watching what's happening in other states. So like Mr. Norfleet said, we can use what's worked and discard what has not worked. And sharing that with the public, sharing that with your colleagues. And then lastly is centering the entire thing. It's about people, it's about families. So centering people and families and telling their stories, right? Telling stories of the people who had to choose between staying home with their dying parent in their last days of life versus going to work. These stories are incredibly important because they move people. And not only that, but they're real life examples of what this policy is costing America today, not having it in place. People having to leave their jobs, people not returning to work, people not feeding their families because of these awful choices they have to make, and choices that we will all have to make. We will all be sick at some point in time. This is not something that happens to only a small number of people. And so, again, centering people, centering stories, all very important.
I wonder if you could speak just a little bit, Senator Mann, about, obviously you are a uniquely qualified spokesperson for the healthcare, health equity aspects of this policy. And, you know, a lot of times we get bogged down, I know, in these debates about the impact on employers or the impact on the economy. And I think I wonder, there's a lot of obviously diverse group of folks in this webinar today, but I wonder if you could speak a little bit to that effort to kind of reframe the narrative, not only around those stories, but also just the realities of our healthcare system and how people interact with that and how important this program is to make that better.
Yeah, so I think, you know, because the pushback comes from the business community, first and foremost, a lot of what we talk about in committees and to people are about impact on businesses. And we have to shift that narrative because that's not what this is about. Businesses do great under this program. We know that we need to move on to what's really important. And so we know that this program, you know, offers time that people don't have to caretake for themselves or for family members. And we also know that the majority of caretaking generally does fall to women. And so we have a program that will keep women in the workplace first and foremost. Second of all, when you offer paid leave to both men and women, we see gender disparities in the workplace decrease. So that's an incredibly important piece too. And lastly, we know that the people who go without leave, the people who struggle the most are women and women of color specifically, are people who take part-time jobs to make ends meet, people who are low-wage workers. And when we have a program like this, it evens the playing field and it gives women of color certainly finally a chance to have the same benefits that other people in society have. And so generally we have programs like FMLA, Social Security even, who have left out women, of color. And we have written a program in a way that we have left nobody behind. And that's incredibly important to even the playing field.
So I know there are a lot of folks in the webinar who come from states that maybe don't have a Democratic trifecta. And just to, you know, for those folks who aren't familiar with Minnesota, we did have a Democratic trifecta in passing this legislation last session, but we only had a 1-vote majority in the Senate where Senator Mann was moving this piece of legislation. So I wonder if you have any advice or thoughts other than what you've already shared in terms of, you know, kind of thinking about, you know, educating folks, the public, legislators around this policy when it feels like it's a long shot and a difficult challenge given the political realities.
Yeah, and it was kind of a long shot in our Senate as well. We have a lot of people, again, who didn't understand what paid family medical leave was, didn't understand the impacts of it, had no idea that it was beneficial for businesses, had no idea that it would disproportionately impact women of color, had no idea of any of these things. So having one-on-one conversations with every single senator was something that I had to do to educate and get every single vote, because I needed every single vote, right? And so again, the education piece, incredibly important. Talking to people, having those conversations, and sharing the data from other states, sharing the lessons from other states, and that really there has been no downside to the program. And in fact, it really is one of those programs that is so incredible and so life-changing that we have to share those lessons with other people.
All right, thank you so much. Is there anything else you would want to share before we dive in a little bit on the coalition work around this legislation? We'll all be here for questions, but anything else you'd want to share?
The only other thing I'd say is when you are crafting this bill in your state, make it big, make it a big, robust, wonderful bill, because you are going to have to compromise along the way. And communicate with the advocacy groups, communicate with your colleagues, communicate with your caucus all the time. The more communication, the better.
All right, thank you so much. Senator Mann, I think, is going to stick around for the Q&A, so we will have her come back. I wonder if you can throw up the slides for a minute. Okay, great, one back. Okay, great. Thanks, everybody. Hi, everybody. My name is Deb Fitzpatrick, as already introduced, as the Director of Policy and Research at Children's Defense Fund. Our organization co-chaired the coalition that worked on this legislation, along with the AFL-CIO, so labor, and Isaiah, which is a faith-based organization. We have about 56 organizations that were part of this coalition, and there was an incredible diversity of perspectives. And every one of those perspectives was really important in getting this legislation passed and getting such a strong program in place. As Senator Mann mentioned, we had folks who were more on the research side. We had wonks, like I consider myself a wonk in this space. We also had organizations that could bring C4 or political organizing, as Senator Mann mentioned, to make this issue relevant in the election process, to make sure that this was being talked about as people were seeking to represent constituents in the Minnesota legislature. And so, we also, there's just no substitute for that work of bringing people together across differences with a shared set of values. And it's hard work, but it's really, really critical to get something like this done. Next slide, please. So, we worked on this legislation as a coalition for 10 years, and we worked on it in many years that seemed really unlikely that we would be able to be successful. We brought forward a bill every single year of those 10 years, which was really important, even again, when the political situation seemed like it might be unlikely. This gave us an opportunity to do many of the things that have already been mentioned, to educate decision makers and the public every time we had a hearing, to improve the bill, to incorporate the research and lessons from other states, as has already been mentioned, and to develop strong and compelling storytellers. Among them were small business owners, and I can speak more to that later if folks are interested. And then also to identify and cultivate legislative and agency champions. So as I said, get yourself an author like Senator Mann, but also state agency ally like Evan. So that was really, really important over the years to develop those relationships on both levels. And some years in one body or the other, we couldn't even get a hearing. So we held mock hearings for the press, for example. Finally, this year, the stars aligned and we were ready. But I would be lying if I said we expected this year to be the one back in 2022, mid-2022. So I think it's very important to be ready for when an opportunity strikes. Next slide, please. So I do a lot of policy work in the early childhood space, so I'm really excited again to be here with the BUILD community. I've worked on childcare for longer than I have worked on paid leave, for example, and I convene EC advocates every other week and co-chair Minnesota's Prenatal to 3 Coalition, in addition to the PFML Coalition. So I thought I would spend just a few minutes sharing some of my thoughts about the intersection of these two worlds. First of all, as Senator Mann mentioned, I think it's important to go big. And I think it can be tempting, coming from early childhood space to focus on parental leave or maybe family leave, meaning leaves to care for a new child or a seriously ill family member. But while these new babies are extremely compelling, and I really appreciate that, I would advise, and again, it was really important for us to not narrow our focus in that way, to include medical leave as well as family leave, and family leave for family members as well as new babies or new children. So I think this is really important because it's critical to building a winning coalition and for political viability, and to create a politically viable, stable program where everyone in the state is contributing to the program and everyone can benefit, as well as this is create a more fiscally sound program. Families of young children also, as all of you know, don't come in pieces. And the most common use of paid medical leave in current state programs is for pregnancy complications or recovery. Young children can get cancer or have chronic conditions that send a family into a tailspin, but so can parents of young children. And when older family members need caregiving support, it can impact the emotional and financial health of the whole family. We had amazing storytellers, as was mentioned, bring forward all of these scenarios and more. So I think, again, thinking about moving one of these policies forward, I think it's important to not leave behind medical leave. Also wanted to spend a few minutes talking about gender equity and caregiving and pregnancy discrimination. Senator Mann mentioned this a little bit. A well-constructed paid family medical leave can help address these. And we know it's really important that what we're doing is creating a program that helps all genders be caregivers. And this program is an important piece of that. As was mentioned, employment protections are a key piece of making this a program that all genders can use, as well as generous wage replacement so that primary breadwinners are able to use the program. And then finally, many paid leave programs provide additional weeks for pregnancy complications and recovery, as they should. But we fought hard in Minnesota to allow workers to combine family and medical leave for additional weeks, 20 weeks total, for all possible reasons. And I think that's a really important way, again, to build the big tent, to make it a program where a variety of family needs are addressed while also supporting pregnant workers. And then I wanted to, as Children's Defense Fund, we work to connect families with public supports, and it has been very troubling how much time and energy this takes, especially for low-income families with young children. How much hazing happens as they seek to prove themselves worthy of help. So as we stand up a brand new state program, our coalition is laser focused on partnering with Evan, Greg, and their team to create a program that is easy for families to access, even more important when a new child arrives or during the upheaval of a major medical event. A consistent lesson from other states is that too often workers don't know they are eligible for paid leave. Relying too heavily on either employers or state agencies hasn't worked. That's why we made sure to include dedicated funding for outreach and grants to trusted organizations in the community. Also coming out of our work connecting families to support is the recognition that Too often government gives with one hand and takes away with the other. And so we worked hard and suggest to others, think about this carefully, to make sure that access to wage replacement during leaves doesn't impact people's ability to access other safety net programs. In particular, TANF is one we worked very hard on within our program. And finally, a word on childcare. In Minnesota and many other states, infant care is exorbitantly expensive and hard, if not impossible, to come by. Meanwhile, many new parents would prefer to be the ones caring for the infants. Paid leave can make that possible. Between medical leave for the birth of a parent, for the birth parent, and family leave for two parents, Minnesota's program can provide up to 8 months of paid leave to care for a new child. We also know that the childcare workforce is woefully undercompensated, but also receives scant benefits like paid leave. A PFML program can help level the playing field and ensure childcare workers can take care of their own family and children and themselves, as well as other people's children. Next slide, please. So finally, I'm just going to go over this real quick so we have lots of time for Q&A. Some additional considerations for equitable access, I think was already mentioned a couple times about the importance of strong employment protections. But I think it's also equally important that those protections don't mean anything unless there's strong enforcement. And so we do in our bill also make sure that we have significant funding and significant enforcement capabilities. So again, when a worker takes these leaves, that they know the state has their back. A second piece is around portability. We know that a lot of folks move from one job to the next. They're going to be paying into this program, as we mentioned. And part of the social contract that we're kind of creating through this new program is that if you are contributing to this program, you're going to be able to use it. So we want to make sure that the benefit is portable, and ours is that will move with a worker regardless of where they're employed. And then finally, just maybe goes without saying, but an expansive definition of family was one of our hardest fought victories. And it's so important to recognize again that workers are going to be paying into this program. They ought to be able to use it to care for their family, no matter what that family looks like. And we know that, families come in all different sizes, and we think it's really important not to value one of those configurations over others, or some of those over others. So I'll stop there, and I think we're going to turn it back over to Michelle to facilitate some Q&A.
Thanks, everybody. It was great to hear from all of you, and we are going to move on to the question and answer. We have lots of time for those of you who have heard sort of a high-level overview of what the Minnesota law looks like. And we do have a couple of questions that I want to put forth, and then others may have more to ask, but they're curious. There is some, if we could dig a little bit deeper into, and maybe Deb and Senator Mann, this would be targeted at you more, which is sort of specifically, how did you get the support? Deb, you mentioned it was a 10-year process. So the other question that I would ask is, how did you keep the stamina and the excitement and the engagement of all those people that it took all that time to get this law passed?
Yeah, that's a great question. It wasn't always easy, but I will say the case for this particular policy is just so compelling. I think personally, it was always so aligned with both my personal and professional goals. And I think that the idea that everyone has a story kept us all at the table too, right? This isn't just some abstract thing, right? All of us, my mother passed away a couple years ago, and I had to take leave to care for her before she went into hospice. I had young children, like people have stories. And I think everyone in our coalition was motivated, not only by the professional, or the job related piece of this, right? Like we all have organizations where we're representing people who would benefit tremendously. We also have people in our lives that benefit tremendously, right? Including ourselves. And so I think that that really helps with this particular policy. Is honestly, I've worked on a lot of policies over the course of my life. And this one is the one where I could just say it has such broad ranging fundamental impacts on the way people live their lives that it's hard to walk away. Once you're in this fight, I think it's very hard, if not impossible, to walk away. And I think all of our coalition members recognize that. We're in it for the long haul in that way. And we kept building more and more. Every year we'd add folks. So we got new energy, and that was important, to have new energy in the fight every year as well, and to experience that. And we were able to define small wins every year. Every year, I think we could say there were things that we were able to do that represented a win in the long fight. And every year we held out hope this could be the year, to be honest with you. And so I think that was a really important piece too, right? Like we went into it every year with the idea this is going to be the year, even if that was not didn't square with some people's perception of reality, we were there. So I'll stop there and see if Senator Mann has anything to add.
No, I think you're absolutely right. And that, again, this is life-changing policy. And, as a physician, I see the ways that this would impact people every single day. And the story I always tell was this 20-year-old patient I had in the ER who broke his ankle and required surgery. And he was crying. And I said, I'll give you more pain medication. Hang on. And he said, no, I'm not crying because I'm in pain. I'm crying because if I can't work, I work as a housekeeper. If I can't work, I can't pay my rent. It's every day stories like that. And so how could you not want to keep fighting for that, right? When you see someone impacted by it every single day. And so, life-changing policy, it was the right thing to do.
Great. Thank you both. There was a question about sort of some giving or getting some more specifics on how the job protection piece of the law works. So I don't know I think that's probably a deep. Evan's raising his hand. Okay, so Evan, I'll let you respond to that one.
Yes. So, and for what it's worth, the enforcement of the leave protections is actually going to be managed by our state's labor department, the Department of Labor and Industry. But I've given this presentation enough times with the Commissioner for Labor and Industry that I can kind of rattle it off at this point. I also have my full slide deck right next to me on my other screen. I'd put it in 4 big buckets of worker protections here. The first is that retaliation and interference are prohibited, right? So an employer cannot retaliate against an employee for taking leave. They can't interfere in an employee taking the leave that they have rights to under the law. The leave is a right under the law, and employers cannot mess with that. The second point I would say is the waiver of rights is void. As a condition of employment, you may not require that an employee waive their right to paid family and medical leave. It's a right granted by the state of Minnesota, and you can't. And as a condition of employment, you can't make somebody give that up. The third is that there's continued insurance provisions, so that so long as an employee continues paying their share of a health insurance premium, insurance must be continued while they are on leave, since that can be, obviously health insurance is a critical component of a worker's benefit package, and losing access to that could make it very difficult to take a leave. And the last piece is a right to reinstatement. After an employee has been with an employer for a duration of 90 days, they have a right to reinstatement to their same job or a comparable one if certain circumstances have occurred. So that taking leave does not mean you're going to get moved into a less desirable, lower paying job. after you've taken that leave. So there's kind of 4 big pillars right there. And I think what that's really meant, and I'll naturally defer to the bill author on this, but what that's really meant to do is, I think, make sure that those kind of human factors and that you can take leave and know that you will still be able to come back to your job afterwards.
Senator Mann, anything you'd like to add to that?
No, we authors, the advocates, worked really hard on those job protection pieces. Again, because when we don't do that, we disenfranchise usually our lowest income workers, or people who work part-time jobs, or people who society thinks they can easily shift around, if you will. So we made sure to write in those robust protections.
I just add one little quick element. So there's ability for an employee who's been wronged in this way to sue their employer, a right of action in the court system. But I think it's also important that we included a conciliation option so that the Department of Labor and Industry can help intervene and work with the employer and the employee to resolve some of these differences as well. So I think that's really important, right? Because a lot of people aren't going to be up for going to court or suing their employer, and it puts them in a difficult spot. So we were also very cognizant of that and trying to make sure, again, that we had different ways to enforce these protections in addition to kind of going to court.
Great, thank you so much. Let's see. Oh, this is a good question. So somebody is asking, is there a toolkit? Is there some place that they can go where sort of the business case for these kinds of laws is clearly spelled out for the advocates to sort of take on and take to their legislators? Do you have some recommendations for those folks?
Yeah, I think Main Street Alliance has been a key organization working on these issues. I think the National Partnership for Women and Families has a business case on their website. Small Business Majority is another group that has made the case. There's a group called, I think it's called Businesses for Paid Family and Medical Leave, which is a larger. So there are quite a few, but I think if go to any one of those and it'll hook you up with others. And again, I can't understate how important that small business voice was in this victory to kind of counteract some of these arguments that this is bad for business. So definitely agree that that's a absolute key component for folks hoping to move this in other states.
Great, thank you. So I know, so there was a question, it will begin January 1st, 2026. So clearly written into the legislation with some ramp up time, which is really important to make sure that you're not asked to sort of hit the ground running when the capacity hasn't been built yet. So I'm wondering, a couple of things. One is if there has been pushback from the business community. So that's one question. And then the other question is, what other systems within the government or within the nonprofit sector have been impacted or were pulled in to make this possible? So let's start with pushback from businesses, and then we can go to the other. And I'm not sure who wants to answer that, so I'll leave it up to you guys.
Maybe I'll start briefly, and then maybe Senator Mann, I'll turn it over to you. Since I think you've probably had a lot more of those conversations than I have. But we're naturally, as we're working, both, as the legislation was working its way through the legislature, and as we're looking towards implementation, we're having conversations with with stakeholders across the whole spectrum, from applicants to employers. And I would say that what we're hearing from the business community is it is now the law, right? The bill has been passed. It is now state law. And I think employers have, said to us, we want to make sure that this thing works well. We want to make sure that it is, that it allows us to, continue to have a good relationship with our employees. We're hoping that we can avoid any sort of bureaucratic barriers and administrative hurdles on that. And, and I think that that's a perfectly reasonable and fair, kind of fair set of feedback. And it's something that we're going to be working really hard. We want to deliver a program that's going to work really well for employers and for applicants, right? I mean, it's not an either or necessarily. I think if we are really thoughtful in the way that we design the kind of implementation of the program, we can hopefully make it a delight for people to use and for all of our stakeholders and partners to use. So, I think that's kind of what we're hearing is just like, all right, this is the law. How are you going to roll it out? And that's what that's what we're going to be working really hard over the next couple of years to do. But Senator Mann, I imagine you had maybe you had a rather different set of conversations along the way.
I did, but a delight for people to use is my new favorite phrase. So thank you for that. So business was the number one pushback for this bill. They have always been. They were the number one pushback for FMLA. FMLA was supposed to be 18 weeks paid, and it came down to 12 weeks unpaid with multiple stipulations. So it's always been the business community. In fact, in 1986, I believe we passed 6 weeks unpaid leave for maternity leave in Minnesota. And during all those committee hearings, all we talked about was the business impact. Not one time, not once, did we talk about the health impact on women and on new mothers. And so we tried really hard, and we were quite successful this time around to, again, shift that narrative, because it's not about businesses. We know from 12 other states, businesses do great. And in fact, it's helpful because we keep people in the workplace and in the workforce. But the biggest arguments we heard was that businesses cannot afford this. They were all going to shut their doors. We're going to move out of Minnesota. They can't keep their doors open. And again, we saw that never. We didn't see that anywhere in any other state. We don't see that anywhere in the world that has, and everyone has paid family leave, right? Except for us. We don't see that anywhere. And so those narratives were not necessarily true, and perhaps they were true fears, but they were not based in what has actually happened. And so we had to make sure that, again, present data. This is not going to happen. In fact, 91.5% of businesses said that when it came to productivity, PFML helped productivity or did nothing, like it had no negative impact. And so, again, data, the conversations, the education, but pushing back on that narrative. The chamber came out, the NFIB, the National Federation of Independent Business, all came out with what they call fact sheets about what this will do to their businesses. And a lot of what was on those fact sheets were not factual. And so that was very frustrating for me to navigate those waters. But yes, business was the number one pushback on the bill.
Anybody else want to jump in on that before we move to the second part of my question? Totally divergent from the first. Okay, so we've heard the Department of Labor that has been mentioned. Just wondering if there are other systems that are going to be involved in this rollout and who you had to navigate through to make sure that the law became what you wanted it to be.
Good question. I think any program of this sort of scale is going to be a team sport, right? And just within a state government and administration. So we mentioned Department of Labor and Industry, who will be critical partners on the labor enforcement provisions. We're going to be working closely with the Department of Commerce, which is Minnesota's insurance regulator for what's kind of known as private plans, since insurance companies can choose to offer comparable plans, and businesses can use those in lieu of the state plan. And then it's everything from the state's IT agency, right? I mean, a huge part of delivering a really great program is making sure that the applicant experience is going to be really smooth and seamless, that we have the tools to be able to quickly adjudicate claims and be able to, make sure that we get all the required information and run it with a lot of integrity. And that's a big sort of technology and business process lift. And our partners at Minnesota IT Services are going to be absolutely critical. And all the other sort of finance and administration elements across the state, Minnesota Management and Budget, which is our kind of enterprise budget and finance office, Department of Administration, responsible for buying stuff in the state. It really is. It's a team effort. And I think the good news is that folks, we're getting awesome support from our counterparts across state government. I think folks are, it's an exciting bill. It's also an opportunity to show how well we can do, and an opportunity for us to really shine in terms of delivering services. So I think that part is, it's early days, but it's going really well so far. And we're really excited about what we're going to be able to deliver through partnership across the state.
Great. We have a comment in the chat from Lisa from the North Carolina Early Childhood Foundation, and sharing the research based on these policies, and they're exclusively focusing on employers. And she's put a link in there about ways that they're moving forward or getting support for the public policy, and loved the idea of the mock hearings. So perhaps we will see that happening in North Carolina soon. So the other question that I am interested in learning more about is, there's sort of a group of likely suspects, right, who come together for these kinds of advocacy efforts, early childhood and health folks, and I'm just wondering if how you sort of broadened the tent in terms of the advocates that you pulled in, and if there were any unlikely folks that the advocates in other states should consider reaching out to and making part of this advocacy effort. And Deb and or Senator Mann, if you have some thoughts on this, or anyone, I'd love to hear them.
I guess in our state, and again, this may be different in different states, I think we did a lot of work to bring in groups focused on racial equity, and to sort of help think through some of, how this program could be beneficial to addressing some of our racial disparities in our state, which are among the worst in the country, just to out ourselves here. And so that was a key, I think, lens. So we had done a lot of work over the last few years in our coalition to, kind of make it clear how the current system contributes. And both of our authors, Representative Richardson in the House and Senator Mann, were, great at bringing this lens forward as well. I think the small business folks, and I would just mention at a different kind of one of these convenings, we talked about even legislators who are small business owners can be really powerful voices to speak to, again, to counteract the idea that this is bad, and just talk through, how it would actually work for them as a business. So I think those were some key voices that I think were critical, not in the coalition space, but unexpected, right? We were able to have those kinds of folks testify after the chamber, so that it sort of disrupted the narrative. So I think that's something I would just suggest, is thinking carefully about, who your spokespeople are, but then how you can work with your committee chairs, if you're able to set up the hearing in such a way that none of the negative narratives kind of get as much energy, right? Like you can take it out by bringing it back to the humanity, or challenging some of the negative narratives. I think you know, early childhood is a group of folks that hadn't been deeply engaged in our coalition. Also, when I came on board, it was a lot more labor, some health, but surprisingly, those would be natural suspects, but they actually weren't as deeply engaged in the coalition as we had hoped. And so I think that we did a lot of work also in the last 3 years, sort of bringing on early childhood folks and bringing on the, you know, organizations that represent people with cancer or Alzheimer's or those types of organizations who have broad, you know, pull and connections that we don't normally have. I'll stop there and see if Senator Mann has any insights from like particularly powerful spokespeople that, you know, she was thinks were important.
No, I think you nailed it. Just every story is powerful. Every single story that was told. Because again, people can relate to those stories, and they are stories that we will all eventually go through. We will all have something to take leave for at some point in time, because this is life, right? So.
Great, thank you. So we're coming close to time. I want to thank all of you very much for being willing to share your expertise and your knowledge. If you'll put up the other slide, the next slide, here are the presenters' contact information. So you'll get this when you get the slide deck for this, for the webinar. So, and they've all said that they would be glad to get your emails and respond to any additional questions that you might have. And one other thing that I wanted to mention, if you haven't already signed up for the exchange, it is the prenatal to 3. If you can move the slide. Yes, okay, thank you. So if you haven't joined the prenatal to 3 exchange yet, we encourage you to do that. It is a great place to ask questions, join in discussions, find resources, learn from what others are doing. And the link is right there, and hopefully we can drop that in the chat for you. But you again will have that, and we strongly encourage you to do that. And also want to remind you that a brief evaluation will pop up when you exit the webinar, and we would really appreciate your feedback on that. We do make changes to what we offer you and how we offer it to you based on that feedback. So please fill that out for us. Again, it was recorded. You'll get the slides, you'll get the recording. We will pull out some of the recommended resources that Deb mentioned during the session, and we will get those to you. And I just want to say thank you once again to our presenters, and thank you to all who have attended the webinar. We really appreciate you spending some time with us today, and I'm going to wish you a good rest of your day. Thank you so much for being with us.